Welcome to aminacademy.com. In human anatomy and physiology, in the cardiovascular system, let us discuss about blood circulation in the pelvis and lower limb. Arterial supply. Common iliac arteries. The right and left common iliac arteries are formed when the abdominal aorta divides the level of the fourth lumbar vertebra. In front of the sacroiliac joint, each divides into the internal and the external iliac arteries. The internal iliac artery runs medially to supply the organs within the pelvic cavity. In the female, one of the largest branches in the uterine artery, which provides the main arterial blood supply to the reproductive organs. The external iliac artery runs obliquely downwards and passes behind the inguinal ligaments into the thigh, where it becomes the femoral artery. The femoral artery begins at the midpoint of the inguinal ligaments and extends downwards in front of the thigh. The femoral pulse can be felt at the origin of the femoral artery. It then turns medially and eventually passes around the medial aspect of the femur to enter the popliteal space, where it becomes the popliteal artery. It supplies blood to the structure of the thigh and some superficial pelvic and inguinal structures. The popliteal artery passes through the popliteal fossa behind the knee, where the popliteal pulse can be felt. It supplies the structure in this area, including the knee joint. At the lower border of the popliteal fossa, it divides into the anterior and posterior tibial arteries. The anterior tibial artery passes towards between the tibia and fibula and supplies the structure in the front of the leg. It lies on the tibia, runs in front of the ankle joint and continues over the dorsum, top of the foot as the dorsalic pedis artery. The dorsalic pedis artery is a continuation of the anterior tibial artery and passes over the dorsum of the foot, where the pulse can be felt, supplying the arterial blood to the structures in this area. It ends by passing between the first and second metatarsal bones into the sole of the foot, where it contributes to the formation of the plantar arch. The posterior tibial artery runs downwards and medially on the back of the leg. Near its origin, it gives off a large branch called the peroneal artery, which supplies the lateral aspects of the leg. In the lower part, it becomes superficial and passes medial to the ankle joint to reach the sole of the foot, where it continues as the plantar artery. The plantar artery supplies the structure in the sole of the foot. This artery, its branches and the dorsalis pedis artery form the plantar arch from which the digital branches arise to supply the toes. Venous return. There are both deep and superficial veins in the lower limb. Blood entering the superficial veins passes to the deep veins through communicating veins. Movement of blood towards the heart is partly dependent on contraction of skeletal muscles. Backward flow is prevented by a large number of valves. Superficial veins receives less support from surrounding tissues than deep veins. What are deep veins? The deep veins accompany the arteries and their branches and have the same names. They are the formal vein, external iliac vein, internal iliac vein, two common iliac veins. What is superficial veins? The two main superficial veins draining blood from the lower limbs are the small and the great saphenous veins. The small saphenous vein begins behind the ankle joint where many small veins which drain the dorsum of the foot join together. It ascends superficially along the back of the leg and in the popliteal space it joins the popliteal vein, a deep vein. Now we'll discuss further about blood circulation in the pelvis and lower limb. The pelvis and lower limbs are supplied by a network of arteries and veins. Arteries like a common iliac, external iliac, and femoral arteries carries oxygenated blood from the heart to these regions, while veins return deoxygenated blood back to the heart. Arterial supply. Iliac arteries. The common iliac artery divides into the internal and external iliac arteries. The external iliac artery continues as the femoral artery, which is the main artery of the lower limb. Femoral artery. The femoral artery branches into the superficial and deep femoral arteries supplying the thigh. Popliteal artery. The superficial femoral artery continues distally to become the popliteal artery which supplies the lower leg and foot. Branches of the popliteal artery. The popliteal artery divides into the anterior tibial artery which supplies the anterior compartment of the lower leg and the tibio-peroneal trunk which divides into the posterior tibial and peroneal arteries supplying the posterior and lateral compartment. Venous drainage. Iliac veins. The external and internal iliac veins drain the lower limb and pelvic organs respectively. Femoral veins. The femoral vein carries blood from the thigh continuing distally as the popliteal vein. Popliteal vein. The popliteal vein drains the lower leg continuing proximally as the femoral vein. Femoral vein. Interior vena cava. The venous blood from the lower limb and pelvis is ultimately collected by the inferior vena cava which returns to the heart. Some key points. Arterial branches. Obturator artery. This artery supplies the hip joint and muscles of the medial thigh emerging from the internal iliac artery. Gluteal artery. The superior and inferior gluteal artery supplies the gluteal muscles. Deep femoral arteries. This artery supplies the thigh muscles and also contributes to the blood supply of the femoral head. Posterior tibial artery. This artery supplies the posterior compartment of the lower leg and foot. Venous drainage. Superficial veins, the great saphenous vein and small saphenous vein are superficial vein that drain the lower limb. The venous drainage parallels the arterial supply with veins generally named similarly to the arteries they follow. The venous blood ultimately drains into the inferior vena cava. So far we discussed about blood supplies, blood circulation in the pelvis and lower limb. we have done, please subscribe our YouTube channel.